Do you know the consequences that you can cause when you think that you're managing high blood sugar when the person has low blood sugar? Death. Yes. This can cost the life of that person within minutes, not even hours. My name is Patrick Thoya. I'm a paramedic. And in our today's video, I'm going to take you through how to distinguish high blood sugar or low blood sugar before you assist this person. In other words, I mean hyperglycemia and hypoglycemia. This information is very important because it is going to help you if you're living with diabetes, or you have a friend or a relative or a colleague with diabetes. The first and the easiest way for you to identify hypoglycemia or hyperglycemia is by you testing the sugar level using a machine called a glucometer. This is a machine that tests the levels of sugars in the body. Normal reading should be within 4 millimole per liter to 7 millimole per liter. Anything above 7 is high, and anything below 4 is considered to be low. That is above 7, that is hyperglycemia, and anything below 4, that is hypoglycemia. Most of the time you realize that those people with diabetes, they normally work with this machine. If this person has a relative that knows how to use it, then first get the readings before you intervene. The second way you can know that this person is having hyperglycemia or hypoglycemia is you checking the history. And in this, you want to confirm when was the last meal. That if this person has just taken a meal 1 hour or 2 hours before that emergence, then you expect at that time absorption has taken place. And in the blood system, we have too much sugars because it was just after eating, and the blood capillaries have absorbed most of the sugars into the body stream that expect the sugar levels to be high at that time. On the other hand, when this person tells you that he has some days or he has stayed for long without a meal, then most of the time we don't suspect high blood sugar because the body does not have sugars at that time. We expect the sugars to be low. So on that, then we will highly suspect this person is suffering from low blood sugar or hypoglycemia. Another sign that you can use, and it is in hyperglycemia, this person will be complaining of thirsty. And you'll also note that this person will be taking a lot of water, but after a very few minutes, he'll be having frequent urination. And the reason why this person is always complaining of thirst is because the body is losing a lot of water. You realize that when the sugar levels are high in your body, that is going to affect with the movement of the water. And you realize the body will be losing a lot of water, and that's the reason for the frequent thirst. On the side of hypoglycemia, where the sugars are very low, the message that the body will send is, can you eat something? We need sugars in our body. So the body will send a message, and that's why this person will be complaining of hunger. That's one of the easiest way you can know. In this side, thirsty. On the other side, hunger. Another thing that we can observe from the patient is in hyperglycemia, you realize that this person will be feeling weak and fatigue. But in hypoglycemia, this person will be aggressive, as they always say, and a hungry man is an angry man. But in another way that you can confirm if it's hyperglycemia or hypoglycemia is by you feeling the skin condition. So you realize that when this person is in hyperglycemia, the skin will be dry and hot. That is hot and dry. But on the other side, the skin, if it is hypoglycemia, the skin will be cold and clammy. So you can pick that. Another sign that you can use, especially in hypoglycemia, is you need to confirm what was this person doing when it started. Most of the time, after an exercise, we expect the sugar levels to go down because the metabolic activities in the body is very high. And remember, in any metabolic process, then oxygen and glucose are highly used. So there's high chances that sugar levels have gone down. So in addition, in hypoglycemia, other sign is you find that this person is tremoring. Good example is when you stayed for long. I know most of you, there's a time that you stayed for long without eating, to a point that you could feel the body is like tremoring. That tells you that at that time, the sugar levels in your body was very low. The last sign that I want to confirm to you or to share with you is in hypoglycemia and hyperglycemia. You realize that in hypoglycemia, the condition will be deteriorating very fast, unlike in hyperglycemia. So when you find that the level of consciousness of this person is deteriorating very fast, mostly we suspect it's not hyperglycemia, but it is hypoglycemia. Thank you for watching. I hope you enjoyed this video. In my next video, I'll be talking about the risk factors to diabetes. So kindly subscribe so that you don't miss this.